Good morning. Good morning.
How you doing? Minister Mulroney, regarding the joining the BC lawsuit, why was it important for Ontario to join that province as opposed to launching your own, for instance?
Well, our proposed legislation is modeled after the BC legislation. We want to make sure that we can recover for the harms that are done here in Ontario to Ontarians. And so it was necessary for us to have our own legislation in place so that we can do that. We think that we have got a great opportunity working closely with BC in order to recover for the people of Ontario in this way.
And you mentioned special rules in the legislation. Can you expand a bit on exactly what those are and what they allow the province to do?
Yeah, first, it will create a cause of action for us to be able to, a statutory claim for us to be able to join the case, but also some different rules to allow judges to be able to go after to ensure that the aggregate class can recover those damages. And so a bunch of technical rules, but really this is about making sure that Ontario is in a good position to be able to recover for the harms that have been done in the past and ongoing harms that are occurring as a result of the opioid crisis in Ontario.
Thank you.
Question similaire, mais en français.
Oui.
Juste m'expliquer un peu pourquoi rejoindre la Colombie-Britannique, pas lancer la propre recours collectif ici en Ontario?
Et ça nous donne une chance d'avoir les dommages et d'être dans une très bonne position pour nous joindre à la Colombie-Britannique, mais c'est pour avoir les dommages qui ont eu lieu ici en Ontario dans le passé, mais aussi couramment.
Oui, puis là, on s'engage dans une bataille judiciaire qui pourrait durer plusieurs années. Est-ce que vous avez une idée du montant qu'on va peut-être dépenser en recours dans le processus judiciaire?
Donc, les dépenses du côté judiciaire, c'est le Class Counsel qui va payer ces coûts. Et pour les coûts qu'on va recouvrir un jour, ça sera à découvrir pendant the litigation.
Merci.
Ms. Martin, Mayor John Tory spent Saturday canvassing against the cuts to municipalities in your riding. Did you receive any calls, or did that have any effect on the decision to reverse the cuts?
Well, I'm always happy to have the mayor in my riding and to talk with him about these issues. As we've said all along, we've been wanting to sit down and talk with municipalities and work with municipalities on these issues, and so we have an opportunity to do that. Mayor Tory is someone that we need to work with. 92 cents of every dollar that the provincial government spends goes to transfer payment agencies, including municipalities and school boards. And so we need to work with our partners in order to be able to balance the books, which we promised the people of Ontario that we would do.
Did you receive any calls from your constituents, though?
I've been receiving calls from my constituents on all issues and on both sides of all issues, including this issue. Recently, I was in my constituency office all week, so we've been talking to a number of constituents. Certainly, there's a lot of I should say, a lack of information on some of these issues. So it's important to have those conversations, but I have had supportive calls. Keep doing exactly what you're doing because we need to get back to a position of balance. I mean, the largest cut to our funding is frankly the fact that we pay $1 billion every month, in interest on our debt, and that's not sustainable. We need to have that money to invest into frontline services, especially in healthcare.
I'm wondering if the government can say at this point how much it's going to spend to establish the centers of excellence, how many people will work for them, what their ongoing budgets will be.
Well, I don't have a lot of detail about that, but really it'll be part of the allocation, the funding allocation already set aside for Ontario Health. So it's not, we're not trying to create a large bureaucracy. What we're trying to do is model Cancer Care Ontario's kind of vision of how to manage and have standardization of quality and performance and oversight. But we don't want to proliferate back office supports. That's the whole point of Ontario Health is to have these organizations share back office support and administrative functions. So it's not a huge cost. It's part of our allocations for managing Ontario Health already set aside.
The word crisis was used a number of times today to describe the opioid epidemic in the province. If that is the case, and that is what this government believes, why not open more safe consumption sites? Why cap them or close some, as we've seen?
We have 16 operating consumption and treatment service sites across the province. That is the number of applications that have been approved. We're still receiving applications and reviewing applications. And you know, we're certainly willing to open sites in areas of high need, which is what we've been doing. But we haven't even reached the number that we've established at this point. It is a very important area. We take the opioid crisis very seriously, and we've actually created a better model based on what experts told us at various roundtable discussions, which has a comprehensive kind of wraparound service, so that we're not just providing a place for people who need support. We're also providing further supports, including primary care help, including wraparound kind of service, so that they can have a chance when they're ready to get off of drugs, to have rehabilitation and treatment. And that's sort of, our model is an advanced model. It's an enhanced model from what existed before, based on expert advice.
Could you please speak to an explanation for the decision to do a reversal on the funding cutbacks that were so hotly debated with the city, between the City of Toronto and the Ford government?
Our plan has always been to make sure that we get maximum value for every taxpayer dollar, and that's what we're doing. And we've always said all along, we're willing to sit down and talk with our partners. We have to work with our partners. As I mentioned, 92 cents of every dollar that we spend goes to these partners, and so we need them working with us to make sure that every dollar is spent wisely. So it's part of our strategy to modernize our system, to make sure that that we look at where we can deliver, how we can deliver services smarter. And as I said before, we're willing to sit down and talk with our municipal partners, with our school board partners, with everybody, to make sure that we do this in the best possible way.
I don't know which one of you might be best suited to answer this question, but when it comes to the actual cost that you've estimated as far as the damage is concerned that's caused through the healthcare system by opioid drug abuse, can you put a number on that? Do you have an idea of what you might be looking for?
We know that the costs are very high. We know that the costs of the healthcare system in the past and ongoing are high, but we don't have a figure. It will develop over time during the course of the litigation.
Hundreds of millions, billions?
We're talking about a lot of money.
Parliamentary Assistant Martin, can you give us a little bit of a laundry list or a bit more detail about who all these different partners will be in this integrated hub for mental health?
Oh, in our Centre of Excellence
Yes.
for Mental Health and Addictions? Well, the Centre of Excellence will be reporting to Ontario Health, so it'll be like where we're putting Cancer Care Ontario, Health Quality Ontario, those organizations, the Trillium Gift of Life Network, underneath Ontario Health and reporting to that body. So it will be helping to sort of have a provincial oversight of the whole system of mental health and addictions. A part of the problem with our current system for mental health and addictions is that it's extremely fragmented. And if you talk to anybody in the sector, they know that. It makes it very hard for patients to be able to navigate the system and get the services they need. There are services sometimes, but people don't know about them, including primary care doctors in some communities may not know all the services that are there and available, or what is the best service. So we need a way to standardize, to make sure we deliver a better and more consistent patient experience.
Will it include things like, beyond hospitals and clinics, will it include things like, I don't know, meditation programs or other therapies that currently aren't covered but have been proven to be helpful for mental health patients?
So on the specific services that would be delivered for mental health and addictions, other than what we've announced that we're funding, I think this will be one of the decisions made by our local Ontario health teams as they arise. And it's really what are the appropriate services for the community. So what may be appropriate in a northern community with many Indigenous people may not be the same as what is appropriate in a downtown Toronto community. And that remains to be seen. And certainly we're consulting with community partners about what works and making sure we build on what works and also allow local differences.
Okay, thank you. And can I ask one question of Minister Mulroney? Could you just give us a little update of what is happening with the BC case and what happens going forward in the near future?
Well, with the BC case, there will be some developments in June. We want to be able to join. We want Ontario's case to be as strong as possible, which is why we're introducing the legislation. I won't speak into any more detail about that because it's ongoing, but we want to make sure that Ontario's case is as strong as possible so that we can recover for the harms that occurred here.
Thank you very much. We're going to do a quick photo with the ministers.